So again, thank you for joining January's office hours. Today, we will be doing an overview of the new Luma experience. I'm really excited to have a slew of wonderful team members along with me today to really dive into the new functionalities and the new design that is available to you in Luma. So if we can roll on to the next slide here, thank you. Just to introduce myself, my name is Bryce. I'm a part of the customer success team here at Luma. I'm really excited again to have a handful of other team members with me, starting with Jennifer Etter. Jennifer, if you want to introduce yourself.
Hey there, I'm Jennifer. I lead our design team here at Luma Health. Nice to meet you all. Armando, you want to go?
Oh, yes. Sorry. The prompt. Slow to unmute. But yes, I'm Armando Perez. I've been here here at Luma for about 3 years, and I help folks out as a engineering manager.
Hi, everyone. I'm Brittany Gardner. I'm a product manager here at Luma and been here for just about a year.
Hi, everyone. I'm Carla. I've been here just about a year as well. I'm a product trainer and may have seen you on a few product training calls. And I also work on Luma U.
Awesome. Thanks, everyone, for introing themselves. I did just want to note that this session will be recorded and will be sent out. So if any of your fellow teammates weren't able to join us today, you can always circulate this recording internally or with the folks that may want to see a bit more info on the new user experience that we have here today. And then also wanted to quickly note that we will have time at the end of our session for Q&A. Feel free to put your questions in the Q&A section, and we'll be sure to tend to those at the end. All right, Jennifer, going to hand it over to you to go over the agenda.
Awesome. Thank you, Bryce. All right. So super excited to talk to you today about the new Luma experience, including what is it, what comes with it. We'll breeze through that very quickly so we get to the more exciting part of this office hours, which is the demo. And then, as Bryce said, we'll have a little Q&A at the end. So, Luma experience, let me tell you a little bit about why we embarked on creating this new Luma experience. And the driving force behind all of it was really staff success, enabling your success, making sure that your workflows, like the way that you do your work day to day, like all those things were smoother, easier, faster for you. At the end of the day, we are a patient success platform, and what that means for us is to enable you to have those meaningful, engaging experiences with your customers, patients. So 3 values that we had top of mind when we were developing this was to increase your engagement, was to increase your efficiency, and above all else, make sure that you were satisfied with the tools that we were giving you to do your jobs. All right, so what's in the new Luma? The easiest way to think about it is the things that come out of the box with our new experience, as well as the products that you get access to. So I'm going to dive a little bit into these things. So in terms of features, the most obvious thing that has happened is that we have refreshed the UI. And we have given it a new, more modern look and feel. We've also not just given it a fresh coat of paint, but we've also tried to make things as just more intuitive, reduce the number of clicks that you have, make search easier. And one of the more exciting things that we did was to give you a customizable dashboard. So you can customize Luma to what you need to get done every day. We've heard time and time again that everyone uses Luma a little bit differently, and they didn't like to be confined into just one way to use Luma. And so we really leaned into that and try to give you as much control as you could to help you orient yourselves when you log into Luma every day to get the things to get the most important things that you need to get done. And then one of the more interesting things that we did with this as well was to launch message template translations using AI. Translating templates is a very manual and very time-consuming process, and it's one of the it's a challenge that we've heard from all of you. And so what we decided to do was to try and make that as easy as possible using, well, AI. So those are the features. And now let me tell you a little bit about the products, that some of the new things that we have launched that you get access to as part of the new Luma experience. One of the more exciting things, and honestly one of my favorite things that we have launched in recent years, is the Insight Center. And the way that I think about this is that this is a way to look back at your workflows and see how well your patients are doing in their patient journey. Like, are they successful? Where are they succeeding? Where are they falling off? Like, where are they actually going? And so using this, you can make data-driven decisions for your organization. Lastly, we have launched a product called Scheduler Assist. It's an early access, and you're able to find the right appointment for your patients all within Luma. So that is a very, very quick overview as to what is in the new Luma, Like, we try to pack it with as many new things as we could, just to like, we're always trying to drive fast and give you things that would make your workflows, I guess, and make your day-to-day just easier. And yeah, so without further, brief break first for a quick poll, and then would love to turn it to the team to do our demos. Yeah, so we're really curious to hear, for those of you who have gotten the new landing experience already, hopefully that's most of you, have you customized it yet? Awesome. Seeing a few no's. And yeah, Armando will walk us through how you can customize it. If you weren't sure how, it's a great time to go through that.
Yeah. Thank you, Jennifer. I do see we have a couple yeses, but a few more no's. So I get to show you all not only around the new experience, but how to customize it. Because we know different folks obviously have different responsibilities on the day-to-day, and customization was definitely a cornerstone when we built this. So enough of me yabbering. Let me share the screen. Okay. Here we go. So this is the new landing page that you will see whenever you log into Luma, which just to contrast it to the old landing page. So this is what you previously would see. And of course, we have the activity feed that I think folks are familiar with, that spend time here in this landing page. And of course, we bubble up things that you typically have to take action on here at the very top portion, such as this, a referral inbound by the provider, Bob Smith. Obviously, these are all demo names, hence Bob Smith, so typical. But switching back to the new look, yeah, so want to cover the different sections here and then how to customize each section. So my shortcuts, pretty self-explanatory. These are shortcuts that make it easy to access your most frequently viewed pages, and you can customize these. And I'll show you how to do that here in a second, but just want to highlight that some of these shortcuts also bubble up notifications regarding said pages. So in chats, you're able to see unread messages for scheduling, the unconfirmed appointment types, and there's a few other examples that we can cover later. But just a couple things to call out within the shortcut section. So next is the action queue. And what this replaces was that top portion of the old landing page that showed you different types of activities that you might want to take action on. And we surfaced quite a few more than we used to have, So that way it gives you a little bit more flexibility to take action and review things such as positive or negative feedback that you're receiving, or your Luma bot type notifications that you might be getting in, form type notifications from intake forms. And again, I will cover how to customize this to make it as slim as you'd like from a notification standpoint, or as full featured. Um, Moving along though, for patient trends, this is pretty simple to understand. It's just metrics that you can surface regarding how Luma is performing. And so we have things such as, confirmed appointments, unconfirmed appointments. You can look at things regarding broadcast, patient engagement, referrals. We have quite a long list of trends that you can pull up, and we'll cover those here in a second as well. The last section that I did want to touch on is the patient activity, because this section is actually shall we say, the repackaging of the activity feed that we had in the old landing page. So everything you would see in the old activity, you can now see here in this patient activity, of course, filtered by date, just like you used to be able to, or also filtered by the actual product area. Now with that, I want to show you some of the customization that we can do. So if we go up here to this top, I already clicked on it, but if we go up here to this top right button called Customize, click on that, we can do a couple things. So number one, we can rearrange how the layout of our page actually looks. So if I wanted to move my shortcuts there and move this up here for some reason, I could definitely do that. Or if I just wanted to delete shortcuts because these aren't just relevant to me, I could also do that as well. Save that, and this would be my new layout of the page. Additionally, we can customize each section like I had said. But really quick, let's get our shortcuts back in, and we can do that by clicking on Add Widget, add our shortcuts back in, and they typically, or each new section is placed in the bottom. So we'll move it back up here. And let's say I wanted to customize though the patient trends area. I could easily do this and look at all the different trends that I want to potentially add. So let's pretend I want to add total amount collected. I want to stay on top of our finances. So I can add that. And while that's loading, let's say I also want to reduce the noise here in my action queue. I go here to this top gear button, just like I did in patient trends, and I am able to remove which work type is displayed. So let's remove everything except for appointment request. And that should clear up all the noise except for appointment requests that are coming into me. As we can see, there are none, but that keeps this nice and clean. And then lastly, just as an example, let's say that I don't want to see everything that the that the patient activity section is displaying, and I only want to see these top 4: scheduling, referrals, feedback, and broadcasts. And I actually want to filter this by facility group. Easy enough to do that and save. And as we saw in every single one of these customization modals, there is plenty of things that you can customize in here. I just wanted to do a quick overview so that folks feel comfortable exploring. But yeah, that's how easy it is to customize things. Just click on save and you are ready to go. Now moving on, the next big area that we want to touch on is the new navigation. So in the old UI, if we go back to the new experience, we had all our nav here on the left-hand side, which we would surface a few of the major pages, but we had a lot of pages that were hidden and typically required a few more clicks to get to. So if we go back to the new UI, we have all those same pages now nested under these 3 categories. Insight Center being very focused on reporting. coordination or communication being very focused on messaging, and then coordination has 3 separate sections in it, which make it easy to find, again, those nested pages. So this just helps out in quickly being able to access, again, nested pages that beforehand were a little harder to get to. And then our search works very similarly to how we used to how it's worked already. We can quickly look up a patient, and let's go to Alta here. And you'll see that it takes us now to the new look of the patient tabs page that we have, or patient information page that we have, with all its separate tabs here. All this is just a redesign. All the functionality is exactly the same. So nothing from a tooling perspective that's new here, but more of a design lift. Great. With that, I don't want to take up too much more time, so please add any questions that you all have to this chat here in the messages section, and I will hand it off to Carla so she can cover Insight Center.
Awesome. All right, let me hop into my screen. Okay, so Armando kindly pointed out where Insight Center is. It's in the top navigation here. And depending on what you have configured, you'll have different opportunities for reports here. Jennifer really politely or nicely highlighted that this is a great way to get a pulse of how things are going in your account. And that's exactly what the overview page does. So the overview page is kind of a nice place to check to see if you have a jumping off point you'd like to look into. But really all it is all of these other 4 tabs kind of condensed into the most top lining information. So this is a nice place to do a quick scan. The next page that we have is our patient journeys page. Patient journeys have been described to me as like the oil check light on your car. So this is a place where you can go to just see if things are getting a little hot or a little cold. I don't know if that's how oil works in a car, but we're going to go with that analogy. And these are different charts that you can view. There's some templated charts that will be waiting for you in your account. So for example, we have a few set up here. These will be already preloaded, or you can create your own chart. And these have 2 different versions. I'm just going to pull up the create page to show you the 2 differences. There is the Sankey chart and the funnel chart. The Sankey chart is going to allow you to look at all the different end possibilities with your patients. So you'll be able to select a couple topics and see how they can continue to connect out for different patient outcomes. The funnel is if you want to look at information in a linear way. So you want to see exactly how a patient is getting from point A to point B. So back in here, let's take a look at some example charts. So this one is a Sankey chart for appointments created. And you'll see you have this huge sort of block of all the appointments created in the week, and then all the different potential outcomes that have happened from this from these charts. So what's cool is you can kind of get a temperature check of like, okay, it looks like, not that many appointments get canceled right away. Let's take a look to see a little bit further along the line when those cancellations happen. So this is a great place to kind of check the temperature of things. However, if you want a full view of appointment cancellation, you would use reports, which we'll get to in a little bit. So this is really just to kind of see how things could go depending on that initial starting point for your patient. I'm also going to just show you a funnel chart. So let's look at referral conversion. So this one is a bit more linear. We're looking at out of all the referrals created, how many received messages, and then how many scheduled from those messages. So again, this is just a pulse check. If you want the exact data, use the reports because this one is real-time data, whereas the reports uses your data warehouse and does a sync up. But this is just a great way to take a look at what's happening in your account. Another really cool feature is True Time. So this is where you can actually take a look at how much time your providers are spending in certain appointments and compare over the week. So if you've got your provider over on the left here, right now we've just got some numbers here because this is a demo account, but you'd have your provider names here. You'd be able to see how much time they spent last week in certain appointments and then how much time they're spending this week. And then on the very far right, you'll see if it's either decreasing or increasing. So let's take it look at one that's increased. If we hopped in here, we'd see their true time over the last 12 weeks. So you can see kind of the ebb and flow. You'll see the time spent over the last 7 days with patients, the most productive month that they've had. And over here, it's still loading, but that will pull up their most popular appointment, the appointment that they've spent the most time on in the past 7 days. So here we are, it's a 6-minute appointment that we've got loaded into our demo. The report section is very similar to reports that we've had previously. However, now you can lock certain reports. So as you go through and add your filters to your reports to take a look at exactly what you'd like to review. Oops, sorry, didn't close that. You can go ahead and lock it, and that will mean that the next time you come back in, those reports will be waiting for you. All of our reports are up here at the top. There's a navigation to hop between them depending on which product you'd like to look into. If your organization has custom reports, this will have a little drop down, and then your custom reports will appear here as well. So we have some examples of that have been used for COVID reporting. And you just hop in here and you'd be able to pull your custom reports to this page. Reports dashboards, so like the whole page of reporting has the opportunity to be downloaded, and you can download it as a CSV or PDF. So you can get kind of a whole dashboard pulled out if you're looking to do that kind of reporting. However, we can also do individual reports. So if you'd like to download one metric, there is a ton of options for how you could download that. You can download it into HTML, PNG, for example. And then you've also got some additional options here so that you can download just specific points of your data. So if you only want to download the last 40 data points, you can get that granular and not have to download like a massive report that you didn't need. You can change the formatting, and you can also open up your reports in a browser as well. And then lastly, we have recommendations. This is a really cool feature. It's another pulse check that we've provided in the Insight Center. So what this does is compare your data with Bedrock's data. So Luma Bedrock is all of our standardized data where we're taking the averages and kind of looking at what are the best practices for using Luma. And you can go in and read about those in the Help Center. So if you hop over here, you get to learn about all the different products. But just what happens when recommendations goes on in Insight Center is it will pull up the products that they have recommendations for you already. So for example, if we go down a little, actually we'll go to appointment reminder. In the gray here, we'll see how this account's reminders are doing. And then in the blue, what the Bedrock recommendation would be. And in the green, what the high performance of that would be. So we can kind of see, you know what, we're not doing as well as the average in terms of our response rate on reminders. So we probably want to fix that, right? We probably want to make sure that we are getting a better reminder response rate. So there is some recommendations. And right here, this will, if you click on Ask Your Customer Success Manager, this will open up a ticket for you to say, hey, I want to talk about this specific setting and see what we can do to improve our response rates. It's a really quick way to kind of gauge how you're doing in the Insight Center. And that is everything that we have going on in recommendations in the Insight Center. I hope you check it out. There is a course in Luma U that I'll call out, as well as for just learning about the interface that we'll have a slide for you at the end of the session as well. Thanks. I'll pass it over to Brittany.
Thanks so much. So why don't I give a little bit of an overview about what Scheduler Assist is before I dive into actually showing you. So Scheduler Assist is our staff-led scheduling tool to simplify scheduling for whether it's the call center or for front office employees. And what it does is it simplifies things so you don't have to look at spreadsheets and scheduling templates anymore. It makes it easy and simplifies the complex scheduling workflows that organizations have. And with that, why don't I go ahead and show you what it looks like in practice. So you'll see very quickly here that the scheduling page that I have, well, give it a second to load. There we go. Welcome to Brittany's Health Clinic. This is a very similar page to what you've seen from Armando and from Carla. In this case, I am going to be a scheduler, and I customized my shortcuts to highlight the schedule appointment flow. And what I'm going to do next, it'll give me a second to reshare my screen here. But next, once you click that button there, you're going to go into the Scheduler Assist view. And we are now back. So I'll reshare my screen. So you're going to click the schedule appointment button, and this brings you into Scheduler Assist. And as a scheduler, you know that there's kind of two options. One, it could be a brand new person that you've never spoken to before on the phone, and you're going to need to create a new patient. If you need to do that, you can just go ahead and type in the patient's information, and immediately you'll be able to add that new patient. But in this case, we know exactly who this is. We've seen her before. It is Rudy, who is coming to visit us. So she'll say her name on the call, and we'll pull up her information and just confirm using her date of birth and other contact information that it is in fact her. Now, next, we know that she's coming in for an orthopedic appointment, but she has seen us before. If we wanted to, we could perhaps click on this appointment button and essentially repeat the same appointment and quickly move it directly into scheduling. But in this case, she unfortunately had an injury, and so we're bringing her into our ortho clinic. And if we needed to, we could update her information here. And one really cool feature with this is the entire flow you can tab through, so you never have to move your mouse if you don't want to. And all the questions within the scheduling form are worded in a way so that your scheduler just has to read out the question. There isn't that multi-week, multi-month level of training that's needed for a scheduler. They can just kind of quickly plug and play into the staff-led scheduling tool. So we'll go ahead and we'll answer a few of these questions here. And once we get through these questions and this complex decision tree logic that will surface up what the right next question is, we can go ahead and hit the view schedule page. And here we'll be able to see the list of appointments. In this case, the provider is fully booked, but if we did see an appointment, we would be able to quickly select it and then move into booking. And that is Scheduler Assist. I think I see a question in the chat. The scheduling flow is reading directly from Luma. So if you use perhaps Patient Scheduling Plus, we have a form builder as well, where you can, as a user, go in and actually build these Scheduler Assist forms. So it will read from Luma, but the data will be coming directly from the EHR.
Looks like we have another question from Livy here, Brittany. Where do you verify the insurance?
Are we headed into a Q&A section next? Oh, Libby, yes, I see your question. You absolutely can verify insurance. That is a product that is going to be coming out right now. That's not available during EA, but it is something that is on our roadmap and coming very soon.
Awesome, thanks, Brittany. And I believe we have one more polling question here, if I'm not mistaken. So I will go ahead and open this one up for everyone to answer. What are you most excited about using in the new Luma? Good luck picking one. I would say Man, if I had to pick, I'd go with Scheduler Assist. I think that product will crush it, make it easy for your staff to kind of be in one window, scheduling within Luma. It looks like we have some folks chiming in. Insight Center taking the lead so far. Give it a few more seconds here, get some last minute voters. We got template translations on the board. Insight Center pulling ahead. Awesome. Appreciate everyone participating in that. I'm going to go ahead and close this poll out here. All right, and then Jennifer, was there any other piece of info we want to discuss before diving? There we go. Yes.
Right on cue. Yeah, I think Carla, did you want to talk about Luma U a little bit?
Absolutely. One of the really nice new things that has come out of this remodeling of our dashboard is now you can get to Luma U directly from the top question mark button up there. So that picture on the left hand side of the slide is going to get you into Luma U rather than having to go to the help center and then into Luma U. And then the middle slide is the 2 courses that you can take. They're definitely under 20 minutes. They're really interactive, so you can go in and click and feel like you're actually in Luma when you're not. Those are the 2 courses that you're going to be looking for to familiarize yourself with some of these details that we covered today, or if you want to share this information with some colleagues who couldn't make it today, they should definitely check out these 2 courses.
Awesome, thanks, Carla. And we have a few minutes for Q&A. So I see there's a question here from Lacey asking, outside of reports, can other data in other screens of Insight Center be downloaded off of Luma? For example, the patient journey data.
I was just checking that out there. I don't believe that the patient journey data can be downloaded. It looks like you'd have to do a screenshot for those ones. So that might be something that we want to consider down the line, to make those have the same features as the report section.
All right, and then feel free to fire away in the Q&A section. This is a great time to get those questions answered from any of the content we reviewed or anything that you've seen as you yourself have navigated through the new user experience. So feel free to pop those questions in. We're happy to answer them. All right, looks like we have another one from Andrea here. When changing any demographic info within Scheduler Assist, does that talk straight to the PM system? And Brittany, I think that one may be geared more towards you there.
Thank you, thank you. So when you change demographic information within Scheduler Assist, it's going to update it in 2 places. One is going to update it in Luma, but if you have BiDi, it will also update it in your EHR as well. So you're going to have that seamless flow of information without having to do dual maintenance in 2 systems.
Awesome, thanks, Brittany. And then we have another question here from Melissa regarding the template translation. So how does the template translations work with using the special instructions box?
Melissa, it's a good question. If it's within your template, like what happens with the translation is that it will translate everything like that is within your template. Am I capturing what you were trying to ask, or what you were asking rather? Okay. Perhaps we can talk offline. about that, and then we'll translate any verbiage in the special instructions box.
And I believe that's referring to the appointment type special instructions, I'm assuming there.
Melissa, it should, but let us double check.
Yeah, we'll double check on that, Melissa. I see you said when using the squiggly in scripting, and I believe you're referring to the appointment type special instruction squiggly in that reminder template there. Any other questions, folks? Great questions so far. Thanks for popping those into the Q&A section. If there's anything else, please pop them in there and we'll be sure to answer them. Give it another few seconds to see if anything else comes through. All right. Well, if there's nothing else, we will close out the Q&A section, and that wraps up our office hours session for January. Thank you, everyone that joined us today. Really appreciate you carving out some time out of your busy Thursday to learn more about the new user experience, all of the new features and products that are built within. Thanks to the team. Thanks, Jennifer, Armando, Carla, and Brittany. Really appreciate the support and all the knowledge and insights you've provided. And we will catch you at the next office hours. Thanks again for joining, everyone. Have a good rest of your day.
Thanks all. Nice to meet you all.
Thank y'all.